Today I will be presenting the Tuskegee experiment. Who, what, where, when, and why. In 1932, the United States Public Health Service, in partner with the Tuskegee Institute, introduced an experiment in Macon County, Alabama, to determine the natural prevalence, progression, and prognosis of untreated dormant syphilis in Black males over a period. The study was supposed to last 6 to 12 months, but lasted over 40 years until accounts of the experiment first appeared in the press. It included 400 syphilitic men, 200 infected men. Men were under the impression they were receiving free healthcare, but were in fact being experimented on and were left untreated. By the conclusion of the study in 1972, only 74 subjects were still alive, at least 20 had died of syphilis, and more than 100 had died from disease-related complications. Not only were subjects affected, but 40 spouses became infected, and it was recorded 19 children were born with congenital syphilis. This case demonstrates the unethical misconduct of two institutes and how these facilities failed to maintain public health standards. What was the intention of the study? The purpose of the study was to discover how syphilis affected Black people as opposed to white people. To observe the full extent of the effects of syphilis upon subjects, the scientists involved intended to collect data after their subjects' deaths. Thus, they were deliberately left to degenerate under the consequences of tertiary syphilis. As many of the subjects were poor Black sharecroppers, they were pleased at the chance of free medical care, but the true nature of the study was kept from the subjects to ensure their full cooperation. One of the main ethical violations of the Tuskegee experiment was the lack of informed consent from the study's participants. This not only questions the United States Public Health Service's integrity, but the Institute of Tuskegee's as well. The United States Public Health Service not only lied about this study's intentions to the subjects, but covered up what was occurring to the public. Personal and professional misconduct, such as the lack of integrity, morals, and responsibility, risked tarnishing and jeopardizing the respect and trust of a profession. Subjects were never told of the real disease they were suffering from, but were instead informed they were being treated for bad blood. Why the town of Tuskegee? In 1929, the United States Public Health Service entered a cooperative demonstration study with the Julius Roosevelt Fund and state and local departments of health in the control of venereal disease in 6 southern states: Mississippi, Tennessee, Georgia, Alabama, North Carolina, and Virginia. These syphilis control demonstrations took place from 1930 to 32 and disclosed a high prevalence of syphilis, 35% in Macon County, Alabama. Though it was only a demonstration study, is it not the participants' right to be informed of what the test is concerning or what it will be used towards? A code of ethics was clearly lacking way before the actual experimentation on the 600 Black men commenced in 1932. Without a code of ethics established, there is no unity in standards of performance or moral conduct from any member of the United States Health Services, and there's more leeway for misconduct and the burden of gray areas. Personal and professional standards of ethics. The Tuskegee study in 1932 was initiated by Dr. Teleferio Clark, at the time chief of the United States Public Health Service Venereal Disease Division, who claimed the study was a ready-made situation rather than experiment. It was argued that the Black men that participated in the study would not be treated anyway, which provided the experiment's rationale. Where was the personal and professional standard of ethics? If the United States Public Health Service did not feel responsible for 600 men involved, was there not a single scientist, doctor, or even a nurse who felt personally and morally obligated to inform participants of the hidden agenda behind the experiment? Policies in place and repercussions. Though the Division of Venereal Disease, the United States Public Health Service, and the Milbank Memorial Fund provided statistical support as well as financial support, the study had no supervision by an independent review board or government controls. Without such controls, the Tuskegee experiment had no guidelines in place to verify the proper methods and procedures were in place to maintain the effectiveness of ethical codes. Though ethical codes do not guarantee that occupational hazards within professions do not occur, they can guide the members of that profession to be responsible for their analysis, conduct, and performance. Makes you wonder, would this experiment still have taken place if proper policies would have been in place? The United States Public Health Service syphilis study at Tuskegee did lead to the publishment of the 1917 Belmont's report, which provided ethical framework on which current federal regulations for the protection of human participants and research are based. The 1979 Belmont reports in turn led to the establishment of the Office for Human Research Protection and the Institutional Review Boards. If the policies and boards that were a result of this study would have been in place during the study, it would never have occurred, or if the experiment had proceeded, the outcome would be significantly different. Devil's advocate. At the beginning of the Tuskegee experiment, there was no known syphilis treatment or cure. It can be argued that the Tuskegee experiment was an unusual opportunity or a ready-made situation for observation, and by studying the natural course of syphilis in poor Black men that already had the disease, the United States Public Health Service was hurting no one. Most of the men selected for this experiment already had somewhat advanced syphilis, and as there was no known cure, studying how it physically affects these men would neither change things or hurt them or other people. As the study was neither advancing nor postponing the men's decline, one could say no ethical harm was done. On the other hand, the United States Public Health Service did not make the men involved in the study aware of their syphilis status, nor were they aware of their true involvement of the study. They entered the study under false pretenses of free healthcare services for an illness, bad blood, which the men did not truly have or need to be treated for. Additionally, when penicillin was finally recognized as a cure for syphilis in 1947, the participants of the study were prevented from seeking treatment for the disease they did not even know they had, as it would interfere with the protocol of the study. This is a lack of professional ethics on behalf of the United States Public Health Service, as well as the doctors involved. Did the doctors present forget their vow of do no harm? Targeting of subjects. These men were plied with promises of free meals, free healthcare, and burial cost coverage. It can be argued that these men were targeted and taken advantage of due to their race and socioeconomic status. The researchers and doctors and nurses used their trusted status as authority figures to pressure or trick these men into entering the study without fully being aware of the parameters. Although some studies do withhold some information to control for validity and biases, it must be done while remaining ethical. Whether physicians involved not ethically inclined to notify the participants of what he was truly being treating for? Were medical standards different from what they are today? Secrecy, denial, and unethical medical behavior. The study was initiated was never the problem, but the decades of secrecy, denial of treatment, and unethical medical behavior exhibited by those performing the experiment, for which is unforgivable and excusable. In 1966, Peter Brunson, a venereal disease specialist at the United States Public Health Service, petitioned for the study to conclude reporting on the ethics of the study, but was denied. The Tuskegee study continued for 40 years until Peter Buxton took his knowledge to the press, including Washington Star and the New York Times, in 1972, which led to its end on July 25th, 1972. If Buxton would have never investigated and shared his concerns, would the study still be continuing today? In conclusion, the Tuskegee study is an unfortunate example of where an organization misused the trust of the public and neglected ethical standards for unprofessional gain. 600 poor Black men were subjected to participate under false pretenses in a study that wished to observe the day-to-day effects of syphilis. Not only did the United States Public Health Service neglect to inform these men they were diseased, but they also refrained from providing treatment when it became available. There was no moral sensitivity or sense of commitment from the United States Public Health Service when they decided to involve men in the study under false pretenses. Throughout this case, there is complete lack of moral standards, principles, and values demonstrated by the United States Public Health Service. Since the study was comparing how the natural course of syphilis affected Black men compared to white, were the white men in the other studies treated just as badly? Since concluding this study, the review boards and government controls have been reevaluated, as well as new policies established to ensure that this unethical tragedy never occurs again. And here is my references.